Tinnitus is challenging to treat because it isn't a single disease with a single cause. In many cases, there are multiple contributing factors happening at once. A clinician might identify one or two factors and target those, but relief can still be limited if other underlying issues are also involved. On top of that, different underlying issues might require completely different approaches. That's why when we talk about possible supplements for tinnitus, one of the most important questions is what's actually causing your tinnitus. Broadly speaking, the causes for tinnitus tend to fall in a few main categories, including hearing loss or inner ear damage, ear canal problems, medication or toxin effects, jaw and neck issues, neurological causes, vascular issues, and systemic or metabolic conditions. With that in mind, it helps to think of supplements in two groups: those that are more targeted and may directly influence tinnitus itself, and those that play a more supportive role, helping the body recover or function better overall, which may indirectly ease tinnitus even though that's not their primary purpose. The most common type of tinnitus is related to hearing loss or damage in the inner ear, also known as cochlear damage. When the tiny hair cells in the ear are damaged, whether from aging, loud noise exposure, or conditions like Meniere's disease, the brain receives less sound input. In response, it essentially turns up the gain, which can create the perception of sound that isn't actually there. This type of tinnitus is often high-pitched, affects both ears, and tends to be chronic. It's also commonly linked with some degree of hearing loss, even if the person isn't fully aware of it. When it comes to supplements for this type, the evidence is generally weak, mixed, and often not placebo-controlled. Some studies suggest that melatonin taken at night may reduce how intense tinnitus feels and improve sleep, particularly in men, people with tinnitus related to excessive noise, or those who haven't tried other treatments. There's also some evidence that CoQ10 may help reduce tinnitus severity and improve sleep in people with age-related hearing loss. Small studies have found that Panic's ginseng may improve both tinnitus symptoms and overall mental well-being. Magnesium may have some benefit as well, but the evidence isn't very strong. Indirect research points to magnesium aspartate as the most potentially useful form, though other types likely work similarly in practice. Vitamin B12 injections appear to help, but only in people who are actually deficient. Oral B12, on the other hand, doesn't seem to make a difference. In people with Meniere's disease, a specific pine bark extract called pycnogenol has shown some benefit when used alongside standard treatment. N-acetylcysteine may help protect the ear from noise-related damage, which could potentially reduce the risk of developing tinnitus, even though it hasn't been directly studied for treating it. Low vitamin D levels have also been observed more often in people with tinnitus, though that doesn't necessarily mean supplementation will help. On the other hand, some of the most commonly recommended supplements don't hold up well under closer scrutiny. Ginkgo biloba, for example, is widely used, but most clinical evidence suggests it isn't consistently effective. Zinc is another popular option, yet studies in adults with tinnitus show no meaningful improvement compared to placebo. By the way, I review a lot of supplements here, so subscribe and hit the bell to stay updated, and support me on Ko-fi if you enjoy the content. Overall, tinnitus caused by cochlear damage is one of the most difficult types to treat. While it can still be reasonable to try different supplements, it's important to keep expectations realistic. Consistent or dramatic improvements are unfortunately not common with this particular form of tinnitus. Another common category is tinnitus caused by problems in the ear canal or middle ear, which interferes with how sound travels. This type usually affects just one ear and is often reversible. Common causes include earwax buildup, infections, or fluid behind the eardrum, and the sound is often described as muffled, full, or pressure-like. In these cases, treatment is relatively straightforward. Fix the underlying issue. Remove earwax, treating an infection, or reducing inflammation can often resolve the tinnitus quickly, so supplements aren't usually the go-to here. A third category involves medication or substance-induced tinnitus, where certain drugs or chemicals irritate the inner ear or auditory nerve. This usually affects both ears and often starts soon after beginning or increasing a medication. Common culprits include high doses of pain relievers like aspirin or ibuprofen, certain diuretics and antibiotics, chemotherapy drugs such as cisplatin, as well as substances like nicotine and excessive caffeine. In many cases, the tinnitus improves once the trigger is reduced or stopped, though some medications can cause lasting damage. When it comes to supplements, the evidence here is quite limited. What research we do have suggests that supplements may be more helpful for protecting the ears before or during exposure to these medications, rather than treating tinnitus after the damage has occurred. For example, one study in patients receiving the antibiotic gentamicin found that those who took N-acetylcysteine experienced less hearing damage. Similarly, a small study in patients undergoing cisplatin chemotherapy found that vitamin E reduced hearing damage. Another early study reported that a combination of CoQ10 and multivitamins may help protect the inner ear and reduce tinnitus in these patients. Tinnitus can also come from issues from the jaw or neck, often called somatosensory tinnitus. This happens because the hearing system is closely connected to the muscles and nerves in these areas. As a result, tension or dysfunction like TMJ problems, teeth grinding or bruxism, neck strain, or poor posture can influence how sound is perceived. A key clue is that the tinnitus may change when you move your jaw, clench your teeth, or adjust your neck. There isn't much strong evidence for supplements here either, but some may help indirectly. For example, in some people with jaw disorders, melatonin has been shown to reduce pain, which could potentially ease related tinnitus symptoms. There's also some evidence linking nighttime teeth grinding to low vitamin D levels, and one review suggested that correcting vitamin D deficiency may help reduce jaw pain. If bruxism is contributing to tinnitus, addressing that underlying issue might lead to improvement. Then there are neurological or brain-based causes of tinnitus, where the issue lies in how sound is processed rather than in the ear itself. This includes things like migraines, concussions, multiple sclerosis, and sound sensitivity disorders. These cases often come and go, and may be linked with other symptoms like head pressure, dizziness, and light or sound sensitivity. In people with migraine-related tinnitus, treating the migraine can make a noticeable difference. For example, melatonin has been found to modestly reduce both the severity and frequency of migraines. Magnesium has also been shown to decrease how often migraines occur and slightly reduce their intensity. And vitamin D may help lower migraine frequency as well. For tinnitus related to head injuries like concussions, some supplements aimed at brain recovery may offer support. One small study in adults with traumatic brain injuries found that Panax ginseng improves sleep, mood, and cognitive function. Vascular tinnitus is a unique type where the sound follows your heartbeat, often described as a pulsing or whooshing noise. It's usually caused by changes in blood flow near the ear, sometimes related to high blood pressure or other cardiovascular issues. This type often affects just one ear and may change with body position or pressure on the neck. Because it can signal a more serious underlying problem, it's important to have it evaluated by a doctor. This isn't something you try treating with supplements. Finally, some cases of tinnitus are linked to underlying metabolic or whole body health issues. Conditions like thyroid disorders, vitamin B12 deficiency, iron deficiency, and diabetes can all play a role by affecting how auditory nerves function or how blood flows through the inner ear. Because these causes can vary so widely, treatment really depends on addressing the root problem. For example, correcting an iron or B12 deficiency, improving blood sugar control and diabetes, or stabilizing thyroid function may all help reduce tinnitus if those issues are contributing. In people with metabolic problems like diabetes, one study found that alpha-lipoic acid improved both hearing and tinnitus symptoms. Other studies have shown that melatonin may help improve blood sugar control in people with type 2 diabetes, while Panax ginseng has been linked to improvements in blood glucose, blood pressure, and cholesterol levels. There's also some preliminary evidence that pycnogenol may help improve diabetes control and even reduce the need for blood pressure medications. When you step back and look at the big picture, it becomes clear that tinnitus isn't a one-size-fits-all condition, and neither are the supplements to treat it. Some types of tinnitus are unlikely to respond to supplements at all, while others may only improve if a very specific underlying issue is addressed. For example, alpha-lipoic acid may only be helpful if tinnitus is linked to diabetes, just as iron or B12 will only make a difference if there's a true deficiency. Even the more promising supplements like melatonin tend to have inconsistent results and rarely work on their own. In most cases, effective treatment requires a broader approach that may include medical care, lifestyle changes, and sometimes cognitive or behavioral strategies. So if you're considering trying supplements, it's important to involve your doctor to make sure you're targeting the right cause and using a safe, well-rounded plan. Hi, I'm Dr. Brian Young. I'd love to hear your thoughts. Feel free to share them in the comments down below. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell. And if you know someone who could benefit from this, please share it with them. Finally, if you enjoy what we do and want to learn more, consider supporting us on Ko-fi, and be sure to check out our other socials as well.